Mandal, and today we will be talking about uterine fibroids. Now, why uterine fibroids are important? Because these are the commonest problem which women suffer in the reproductive age group. Now, what are fibroids? Fibroids are the non-cancerous growth of the uterus. The best part of the fibroid is that these are basically benign tumors. That means 99.9% these are non-malignant, that is non-cancerous. The chances of getting fibroid converting into sarcoma or malignancy is just 0.5%. Now, what are the types of the fibroids? Broadly speaking, these can be of three types. The most common variety is the intramural fibroid, where the fibroid is within the wall of the uterus. The second variety is the submucous, which is the most symptomatic, where the fibroid is towards the uterine cavity. And the third type is the subserous, where the fibroid grows towards the abdominal cavity away from the uterine cavity. Now, depending upon the size of the fibroid and the type of the fibroid, there can be different symptoms of the fibroid. The majority of the women, they're actually asymptomatic. Normally what happens, they have come up for a routine checkup and an ultrasound. Incidentally, a small fibroid is detected. So in majority of the cases, fibroids are asymptomatic. And we normally tell the patients to undergo routine follow-up with different scans at 6 month to 1 yearly interval to see if the fibroids are growing or not. But the other symptoms of the fibroids it can present with pain in the lower abdomen or pain during periods. There can be abdominal uterine bleeding, heavy menstrual bleeding, irregular cycles, or it can also present just as lower abdomen heaviness or a lump in the lower abdomen. Sometimes fibroid can also present with infertility or recurrent pregnancy losses. So depending upon the symptoms, the type of the fibroid, the age of the woman, and whether the woman is desirous of further pregnancy or not, we decide on the treatment options. The treatment option can be of two types. We can go for medical treatment or we can go for surgical treatment. Now, medical treatment, normally we give to the women if there is just mild symptoms, there is just mild pain, or there is just, a little bit of heavy bleeding, then what we do is that we give some medicines for just symptomatic relief. If the women's symptoms are not controlled with these medications, then we offer different treatments to reduce the size of the fibroid. This can start from oral contraceptive pills to mifepristone, or we sometimes give GnRH injections also. And we also introduce an LNG IUS, which is an intrauterine device to control the different symptoms of the fibroid. But one thing should be understood, that these can actually control the symptoms of the fibroid or can reduce the size of the fibroid, but fibroid will completely disappear. These chances are very, very low. The other treatment option is surgical. Now, that can also be of two types, that is whether the woman is desirous of further pregnancy or not. So depending on that, we go for myomectomy. The myomectomy is a procedure where we remove only the fibroid and we keep the uterus in situ in the woman. And this is done especially in young women when they want pregnancy, when there is infertility. In those cases, we do myomectomy. Now, there are two routes by which we do myomectomy. The first is the laparoscopy, which is a keyhole surgery where we take out the fibroid laparoscopically, that is minimally invasive surgery, and the other is hysteroscopically, where the fibroid is towards the cavity, which is a submucous variety, where we remove the fibroid hysteroscopically, that is a scarless procedure. The other thing where we have to do an open myomectomy, where the fibroid is very big in size or we are expecting too much adhesions, then we go for myomectomy, which is open myomectomy, which is very rare these days. The other treatment option is when the family is complete, the age of the woman is more than 40-45 years, then we go for hysterectomy. Now, hysterectomy can again be done by two routes. The first is laparoscopically, which is the most preferred route these days, and the other is open myomectomy, which is the conventional route. Now, the advantages of laparoscopic myomectomy is obviously quick recovery, less pain, less hospital stay, less blood loss, less chances of infection. So these are the different treatment options for